All right, folks, welcome back to the Green Pill Podcast, where we focus on making health simple for you, but more importantly, for your family, your loved ones, and your community. My name's Alex Shinkarovsky. I'm your host. I'm a health and lifestyle consultant based in Miami. I use wearable devices, biometric data, and testing to help people reach their full potential. Today's guest is Dr. Yuli Fradkin. Dr. Fradkin is an expert in child psychiatry. And in today's conversation, we'll touch on everything it means to raise a healthy child, adolescent, and even adult. All the components, physiological, psychological, social, family, and much more. We'll have particular focus on what it means to be okay versus thriving. What it means to be someone who is socially we'll touch on specifically what it means to be okay or functioning versus thriving. We'll touch on the rising trend of anxiety and depression in our kids and our adolescent teens. Where it comes from. Is it a result of overdiagnosis or... We'll touch on the rising trend of anxiety and depression in our kids and teens, where it comes from, what social pressures they're facing, etc. We'll touch quite a bit on autism spectrum disorder, and we'll touch a lot on the various determinants of mental, emotional, and even physical health. Dr. Fradkin has an incredible background, having studied at Tufts, Beth Israel Medical Center, and at the Russian State Medical University in Moscow. He's done quite a bit of research at Rutgers, Yale, and other institutions, and he is still doing research, so you'll hear about that. This is someone who's passionate about it, who's extremely involved, and extremely mission-driven. So you'll get a lot out of this conversation if you're someone who has kids or is thinking about having kids or just wants to understand their own development. Without further ado, here's my conversation with Dr. Yuli Fradkin. Dr. Yuli Fradkin, welcome to Green Pill. First question, will you take the green pill?
Wow, interesting beginning. I will try. I like all green, so it should be on my menu.
All right, there we go. Good answer. Dr. Fradkin, as folks heard, your focus is child psychiatry, adolescent psychiatry, but you have broad-ranging interests in medicine and health around that. What made you become a doctor in the first place?
You know, my father was a psychologist. He worked in university, and since childhood I was surrounded by his students, his PhD pupils, and our house was always full of people who talk about science, about psychology, about child development. So when I grew up and I entered medical school, I actually tried to do surgery first, and I realized that it's not give me thrill. It doesn't give me excitement, and I'm not passionate about this. And when I met my father friend who was a psychiatrist and who taught back in Moscow, and he develop all the seminars for psychologists and for young doctors and talk about psychiatric cases and psychology, I was immediately fall in love with this subject. Mm-hmm. And I was so excited and immediately interested in all this. So it was my passion since my early 20s. So I never regret, and I still think that it's amazing field in medicine. Psychiatry and psychology.
Both. And we'll certainly get into what you think is amazing about it, because sometimes folks pick a career and get stuck, especially in the Soviet Union, because the government almost forces you to pick a career early on. In your case, you loved it and still love it. Given your father's work, were you just analyzing all your friends all the time as a kid, or how did that look for you growing up?
Because when you're hearing conversation about Piaget, Vygotsky, Freud, since you basically start to talk, it's immediately come to your mind and shape your interest. And since I've been maybe adolescent, I started to participate in my father seminars with his students and aspirants, and it was extremely rewarding and exciting. Even Soviet Union, when we didn't have a lot of access to psychoanalytic literature or philosophy, we still have this very enthusiastic group of people who committed themselves to science and philosophy. And one of hub we have in small city in Russia where my father was teaching was our apartment, basically, where all the people come and talk. And I didn't have any choice, because it's what I knew since childhood and what I've been passionate about.
So it's just a huge part of your life and really caught your interest. Was your childhood, would you tell us a little bit about your childhood and how you grew up and what was the family dynamics like and things like that?
It's hard to look back because it's a lot of probably myth about my family and about my upbringing, but it was small city in Russia, and it was maybe 10, 15 Jewish families who came from Azerbaijan and become part of intellectual elite in town and become teaching in the university and schools. And we have really distinguished feeling that my family need to be educators and philosophers. And we didn't have rabbis in our city, but it was kind of our synagogue, basically, sure, because all intellectual people come and talk and contribute to schools and education. My father actually established school for young scientists, and it was generations of scientists who been coming up from the school. And right now, since my dad has 90 years university, he passed away 30 years ago, but still we publish a book right now about the school and his students and work they've been done for last 50 years and so far. And
wow.
It was extremely rewarding and satisfying, because you're not just single person in this world. You have tradition, you have responsibility, you have some dedication, and I happy my kids going the same way, going to medicine and science and genetics, and I feel that I'm keeping my responsibility for doing the things as a family, as a tribe, as a generation.
Mm-hmm. Yeah, thank you for touching on that and for alluding to the myth that we probably always ascribe to our own childhoods, sometimes to hide the pain and sometimes just because we forget, I imagine. And so with your patients, what goes really well for a kid when they're growing up, and what's a bit harder, generally speaking? And then we can get into the specifics.
It's so many factors which participate in normal child development, and so many conditions has to be present in order to grow up kid who physically, mentally, psychologically healthy. So it's really so much still mystery how does it work, but at least we start to tease out what happened when it doesn't go right.
Okay.
And since psychiatry deal with physiological and psychological and social issue. For last 1,000 years, we try to figure out what has to be done and what shouldn't be done in child development and upbringing. And now we much more educated and equipped to deal with these different pathways. So we know a lot about physiological dysfunctions and how development can go wrong. We know a lot about psychological issue which could contribute to wrong development. We know how society and family play a role in upbringing and child development, and we also can intervene on this level. So we have so much knowledge right now, and we're so much better prepared to deal with this issue than even 50 years ago when I worked as a child psychiatrist in Moscow. And we just use medication. We didn't use a lot of psychotherapy. We didn't use any medic equipment. Like we didn't have any imaging resources capacity. We don't have any biological tests. So we just use high dose of antidepressants and antipsychotic to treat behavioral issue and developmental issue, not understanding how much social and family factors could contribute to dysfunction. So now I feel that we had so much progress compared to even half millennium back.
Mm-hmm. So 25 years back when you were in Moscow, approximately. Mm-hmm. And so do you see your role as someone who solves puzzles? Do you see your role as a healer? Do you see your role as a sounding board? You know, it's tough to say because you mentioned the behavioral stuff, which is perhaps not always, I consider, in the domain of psychiatry. Sometimes I put that in the psychology bucket or even the lifestyle bucket. But at the same time, you have tools like transcranial photobiomodulation, which we'll discuss. Other assessment tools like brain imaging. So you have so many pieces at your disposal. How do you see your role with your patients?
Now we have advantage to work as a team because we have psychologists, we have neuropsychologists, we have clinicians, we have therapists who can communicate with us and to do their job. But basically, my role as a psychiatrist is just to do full assessment and to figure out what pathway probably developed wrong and to investigate that. So we every time when we have child come into the office, we start asking about basically all biological development, how kid was born and how was his early ages happened, and did he have any medical or physiological issue when he was toddler, and we check his social, motor, cognitive development, and we observe how family function and how interaction happening in front of your eyes. And getting all this data together, you have preliminary assessment and hypothesis. What kind of level or issue you're dealing with? Is it a developmental issue, like we have kids with autism or neurodevelopmental disorders, or we have issue with mood and mood regulation, like we have kids with anxiety and depression, or we have more major psychiatric issue like kids with bipolar disorder or schizophrenia or personality disorder, or something going wrong in a family, and we can see that this level of miscommunication and abnormal function of the family can create also significant issue in child behavior and child psychological life. So a role psychiatrist in this case is just to figure out what's possible abnormality you deal with, and after that you have a variety of options how to intervene. You can do psychotherapy, you can do medication management, you can do group therapy, you can do family intervention, or you need to consider more biological investigation. Sometimes epilepsy in children could present as behavioral problem, even child never been diagnosed with epilepsy. Or parents have no clue about probable autistic development in their child, and your role as a psychiatrist is to bring the attention to possible developmental issue and further a diagnostic process to rule out some developmental problem. Yeah, so you work as a team leader, as a diagnostician, and as a person who try to organize the process altogether and guide this process to help family to help child to get better and to have normal and happy life.
Amazing. Thank you for the detailed description of hypothesis, decision-making tools available, and your role as a maestro, so to speak, or a conductor of the process. Maybe starting with mood disorders, anxiety, depression, how does that present in kids, and has that changed over time in your years in practice?
Yeah, it's a very important question, because in practice of child psychiatrist, mood disorder is most prevalent pathology you deal with. Currently, we think that almost 20-25% of all kids, adolescents have some kind of mood dysregulation, mood issue, mostly presented as anxiety, specifically increased and tremendously exploding after COVID time, but also
how do you define it?
Uh-huh.
Sorry to interrupt. How would you define anxiety in the context of adolescents and children?
Yeah, basically parents bring your child saying that child become extremely worried about everything, about grades, about common exams, about some tests, or just going to school, and conscious about attitude other kids or teachers. And at some point we have all kind of variety of symptoms, but it can present as just general worries and uncomfortable thinking and intrusive thoughts, or it can present with a lot of physical symptoms. Kids have severe headache, stomach ache, some chest palpitation, or some pressure, or some sweating, or some breathing issue. And all this anxiety and panic attack have myriad of different physiological symptoms, and it's really hard for parents to realize that behind all this medical complaints, sometimes you deal with just generalized anxiety or panic disorder, as this children face. And sometimes parents have to bring kids to multiple providers, pediatricians and gastroenterologists and pulmonologists, until they get message that we don't see any medical pathology. It's nothing wrong with their heart, lungs, liver, kidney, something going on mentally. And it's sometimes difficult for parents to bring child to a psychiatrist or psychologist, but eventually when it's happened and they get helped, it's huge relief, because kids or adolescents start to feel better and have fast improvement when it's have proper treatment. Yeah, so unfortunately we faced right now huge explosion of anxiety disorders and mood disorders in this population, and Actually, Academy of Child Psychiatry call this is a crisis because it's so much prevalent and so a lack of support and treatment for these kids. So it's really national emergency. Pediatrician also been talking about this and psychiatrist, and we now have a really kind of emergent situation when so much kids get depressed or anxious, suicidal, self-harm, distraught, and hopeless.
Wow. And so you presented the gamut from generalized anxiety about grades, going to school, friendship, the concomitant symptoms of sweating, of stomach pain, of chest beating fast, of headaches, etc. And then you presented the other side of the spectrum, which is self-harm, suicidal ideation, what seems like an extreme outcome, but you're saying 25% or so of kids, generally speaking, are somewhere on the spectrum right now. Is that correct?
Exactly. On having some long-term or short-term consequences or require some kind of help. Sometimes it's just need talk with school counselor or some few sessions with therapist, or sometimes you really need to have really severe intervention with medication management and support therapy, sometimes group therapy, sometimes day treatment program, sometimes hospitalization. Yeah, unfortunately, after COVID, it's been most complaints coming from our families is related to anxiety and depression.
And when you think about defining anxiety and putting it into a cultural, social context, what explains, in your view, the significant rise in anxiety and depressive symptoms in our kids?
It's interesting because my first research work back in Moscow was about depression in adolescents. And we saw a lot of city population, mostly girls and boys age 12, 16, having severe depression and anxiety, but it still was not as prevalent. And back then it still was not typical for parents think that their child has depression or anxiety. And working in this field, you really see how things change. First of all, it's not just because, it's also because we have more prevalent mood disorders in population, but also recognition for these symptoms become much more accepted in society. So people don't hesitate to talk about these things. And COVID bring a lot of attention to this issue, and parents not shameful about talking about their kids' depression or anxiety or panic attack now, and a lot of stigma went away, and it's very helpful for society that we actually can recognize it better, we can see it better. It's not hidden from eyes anymore, and we have much better education and treatment options now. But we definitely see increase in prevalence in society, this problem and recognition. And talking about causes, it could be really argumentative or any not clearly defined process, but we definitely know that social media contribute a lot to increase anxiety and depression in kids and adolescents. Definitely the way how kids communicate, so more times they spend home in front of screens, in front of social media, a lack of real interaction with peers, social pressure, as we know that how much now kids need to spend on education and on college preparation and sport activity. So it's built a lot of tension and pressure for them. I was surprised. My son had conversation with a soccer coach, and I was present in this conversation, and somebody told him that he really need to put all this application when he was already at middle school, and he already sophomore, and it's too late to apply to a good college soccer program. And you realize that how much pressure these kids have, additional to their education and training and social. They also need to remember all these things about how far it goes now to put good college application with sport component. Yeah, so it's they don't live in reality anymore. They don't live here and now. They always occupied with all this must and pressure and parents' requests and school requests and soccer training requests, and it's definitely all contribute to increased anxiety and depression in our kids.
So social media, one, which inevitably makes you look into the future or the past, but certainly not the present. It's certainly taking you elsewhere. And second, it almost sounds like our kids are becoming adults too early. It sounds like my life, where I worry about what my partner says, what my job says, what my clients say, where I'm going. And so my natural response is perhaps the US's socioeconomic competitiveness has gone up, opportunities have gone down, costs for housing, education, healthcare, etc. have gone up. And so parents perhaps are putting the pressure on the kids downstream to achieve faster. Would you say that's an accurate characterization of the social dynamics? Or what would you add to it?
No, I think you're totally right. With all this competition and resources not as available as for previous generation, our kids face a lot of pressure and a lot of hard work need to be done in order to be successful and happy members of society. Also, they really well educated about climate change, about wars, about all this change with artificial intelligence and threats what it can bring to society. So they don't have as much optimism as previous generations. They don't have enough believe in the future because they face so many problems and they talk about this. I surprised how much my son, he's sophomore, he talk about wars right now in Middle East and Ukraine and coming elections. So they really informed well about all these issues in the world, and it's not bring them a lot of optimism and confidence.
And so what you're touching on is a future expectation of negative, essentially, of a challenge. Is that the definition of depressive mindset in a way, or is it just not optimistic? Where does the boundary lie? Because, and I'll say this not about your son or any other kids, but about people generally, we do live in the wealthiest country in the world. Perhaps in the OECD, Organization of Economically Developed Countries, our education system might be second to last or 25th out of 26, and housing costs per capita and job security, social safety net aren't there. And yet we don't live in Ukraine, right? Where my family came from. And at what point does this fear of the future and fear of not having your place in society perhaps be balanced by this other narrative of abundance and prosperity? Do you see that view come across for kids at all? That balance?
I see that you're right. It's a lot of discrepancy between what potentially they can have and what will bring in them, and it's it's difficult question how they can navigate through this and what they need to pay attention to. But I just want to say that being anxious and being depressed is a normal process. It's biologically inherent in our bodies, and it's actually serve functions which can actually be positive. Like if you're depressed, you actually withdraw yourself from competition and from danger, and it's give you a chance to recover and to accumulate energy and to think and to regroup. As well as anxiety is actually biologically necessary mechanism, because evolutionary negative events much more dramatic and impactful on your life. It's so biologically we're much more attuned to respond to negative things. We think more about negative events. We ruminate more. We prepare more. We pay more attention, and we put much more resources to avoid negative events, because basically it can kill you and prevent you from having kids and having biological continue yourself, your genes and generations. But a positive experience is much less impactful. You have it, but it's not take away your life. It will not prevent you from having kids and your genes to spread out. So it's why biologically we're much more attuned to experience anxiety and depression. And that's why it's so prevalent, but it doesn't mean that it's only bad. We just need to know how to live with this and how to deal with this and how to address it proper.
I've never heard that perspective on depression, and I'd love to go there in just a moment. On anxiety, when you say avoiding negative is more evolutionarily advantageous, because a positive, as you said, it might help you procreate, but certainly avoiding death or disease or being maimed would be more likely to help you procreate. What level of anxiety, could you quantify it for someone, or is it more of a feeling? What level of anxiety is disabling and obstructive, and what level is okay? And I ask, well, I'll pause there.
So some level of anxiety is actually beneficial, and we all know that if you're a little bit anxious before exam or some events, it actually can help you to prepare better or perform better. And people without anxiety, we know that some psychiatric condition when you're totally mute and emotionally blunt, it's not bring you anywhere. Because when you completely lack of this worries, normal worries and normal anxiety, it's actually could be detrimental for your social and for your professional development. So it's good to have a little bit anxious and be able to control it. Problem that when your anxiety become too much and can affect your daily life and your socialization and your professional development, what we see a lot, it's where we think about intervention and we teach patients to address it. Like I give you example, we have children who really great students and have been having good academic success and normal physical development, but at some point their worries about education become so prominent that they start to have not just worries about coming exams and tests and school day, but also it start to present as strategy which push them to avoid social communication, interaction with teachers or kids, going to school, or at some point it start to present with a lot of physical symptoms. I have a kid who he's 16 years old, he's not a kid anymore, but who constantly complain about nausea every time he goes to school, or his appetite really decreased, he cannot sleep well, he has different physical sensation in his body, and he need to take a lot of anti-nausea medication or take to see gastroenterologist because everybody worry about his eating habits. So it's a situation when anxiety become too much and start to affect your physical symptoms, your social communication, your progress academically. So in these cases, you see that anxiety can be detrimental and really harmful for you. So it's all the
some
spectrum,
kind of balance.
but yeah. So you really need to talk about balance here. Mm-hmm.
And my last probably one on anxiety, you hear about the DSM definition of the Diagnostics Statistics Manual, is that right?
Mm-hmm.
The DSM definition, which psychiatrists and psychologists use to diagnose folks, including kids. At what point does somebody functional but not thriving? It's something I think about a lot in my coaching and lifestyle practice, where somebody's kind of okay, they're working, they have a girlfriend, but they're eating junk, they're not sleeping much, they're not moving, they don't feel great, but they're kind of functional. I mean, how do you think about that edge there, which I always thought about myself?
Mm-hmm. It's a very important question, because when patients come to psychiatrists, it's already not an urge. It's usually more right. Dysfunction, more pathology, more problems. So we mostly talk about situation when patient really become dysfunctional and become unable to work well and have a healthy relationship. And when we try to use our methods, including medication, psychotherapy, and we get patient from this zone, another question, how you can get better and reach your full potential. And at this point, it's not medication, it's not psychotherapy, it's other things. It's as you said, it's different lifestyle, it's different mindset, it's different techniques which can really help you to get there. But unfortunately, society still and medicine more focus on negative and pathological issue. But we definitely need to move forward towards our full potential capacity and work on state when you're not ill, but when you're not function proper.
Yeah, that was a good answer, and I think it covered my question about you help people return to the norm because they come to you when they're really not okay. You help them reach a place of being okay. Then perhaps, you and I have collaborated on some patients where we help them past okay, and we help them to be hopefully thriving. And so we've touched quite a bit on mood disorders. Would you prefer to go down the route of autism spectrum disorder or the major disorders that you mentioned, like bipolar, schizophrenia, personality? I know you do a lot of work on autism generally.
Autism is a fascinating field because, again, as other pathology, we see so much increase in prevalence now, and it's become a battleground for so many techniques and intervention and thoughts process behind that. So we definitely can talk a little bit about autism specifically because we do a lot of research now in this field and try to do some interventions. So I've been working back in Moscow in the 90s when we first have this child care facility where we took autistic kids from all over the country. And back then we didn't have a lot of intervention outside maybe severe antipsychotics and antidepressants, and it was not so many behavioral strategies. And we didn't have any clue about any biological underpinnings of this condition. Since the last 40, 50 years, we know so much more. We know about 400 genes probably which contribute to autism. We know a lot about some biological mechanism, how this disturbance on the gene level contribute to some biological processes in cell and synapses, and how it can affect neural development and neural connection and eventually bring pathology. We know that autism is not a universal condition. It's each kid has some different genetic mechanism involved in this condition, and it's in this sense every child is unique, and it's why we probably in the future we will be able hopefully to tease out all the biological mechanisms which affected each kid and intervene on biological level. But right now we have really good psychological intervention, including flow therapy and IBA therapy and different other models which work. But unfortunately, we still have so many kids even in our states where children have a lot of symptoms and it's partially covered, it's partially addressed, but parents still struggle with finding help and finding proper treatment and getting stuck with a lot of financial and social, emotional, medical, and all kind of other issue. But it's very gratifying field because if you really intervene on early stages of child development, you can really do a lot. And we have seen a lot of kids who, with proper intervention and treatment, been able to get back to school and back to college and having job and having families and almost completely recover and have normal life.
Wow, I've never heard that with kids, on the autism spectrum where they're returning to what you'd call a normal life. And so you mentioned a few of the interventions. Could you touch on what is flow therapy, what is IBA therapy, some of the other research techniques you've helped, you've worked on with kids to help?
Yeah, so all these behavioral techniques are working well when therapists, mostly clinician or team of behaviorists and clinician, work daily with kids, trying to help him to develop some important behavioral skills to avoid frustration, to deal with sensory issue, to deal with repetitive behavior, which a lot of autistic kids have. And basically this type of treatment, evidence-based, and we have a lot of clinical trials and studies which prove that these techniques actually work compared to other tons of different treatment which been applied to autistic kids. But actually these behavioral techniques can really help to eliminate a lot of behavioral problem in these kids or emotional problem, because as we know, children with autism is so prone to emotional dysregulation and anger and frustration and anxiety and fear of novelty. So all these techniques actually work to reduce the symptoms and to help them to integrate to society and to communicate with children and other children and to pursue educational road. So it's worked well, but I want to touch new techniques which really start to appear on this field for the last few years. Socially, for example, we work with photobiomodulation. It's behind this idea that some waves like red light or near red light can actually, if we apply this to the brain, it actually goes to the bone, and a small percent of this light actually can really affect neural development and neural connection. It can help with decrease in inflammation and connectivity and neuronal growth. And what we seen that proper implementation of these techniques can actually help with speech development in kids with delayed speech, or with social development for kids who had been having issue with interaction or social communication, or help with behavior issue, because a lot of these kids are extremely aggressive or emotionally unstable, and we have seen that these techniques in range of maybe 16-18 weeks can significantly decrease the symptoms. And we now working on development of this device which parents can use home or in clinic to help to address these symptoms of autism in their children and adolescents. So it's one of this neural development, along with transmagnetic stimulation and biofeedback techniques which appeared for the last few years and have significant potential for treating children.
And so if autism is characterized by emotional dysregulation, difficult repeating behaviors, you gave a few other examples of how it presents for kids and the challenges for caregivers therein. The previous approaches when you were in Moscow were more behavioral or medication based, and what you're saying is that the paradigm is shifting towards a direct brain stimulating approach without molecules, but more from a exogenous standpoint, so something on the brain like transcranial, or something in the nose like photobiomodulation. Do you see that? I know you ran a study in 2022 that saw significant improvement in such behavioral components, caregiving fatigue, sleep even improved based on a questionnaire, and that was with 13 kids over, you said about, how was it, 13 weeks or more number of weeks?
Yeah, we have 15 kids in placebo and control for 16 weeks. Mm-hmm.
16 weeks. Mm-hmm. And so how many kids in the U.S. are considered autistic or on the autistic spectrum? And maybe you could just briefly define the autistic spectrum and what it is.
So it's actually growing up, and now it's every 1 in 37 kids in New Jersey.
Okay.
It's been 1 in 65, 54, but it's actually growing up, and now between 37 and 45 each. In 37 kids could be diagnosed with autism spectrum disorder, and New Jersey, unfortunately, one of the biggest prevalence of autism, as well as Washington State and California.
About 3%
Yeah,
of
so
kids. Yeah. Is that right?
Yeah, so it's growing. It's been 1 in 100, but now it's climbing up. So you see that it could be better diagnosed, but it's definitely, we talk about increasing prevalence in population.
And the increasing prevalence, always a tricky question from what I hear. Of course, it could be diagnosis. What do you think the increased prevalence is due to?
It's a question where all minds go now, and we don't know.
Trying to figure it out.
We think that it could be stress, it could be pollution, it could be toxins and environment, but it's no clear answer why it's happening. Definitely increase in better diagnostic tools, but we see this. It's unfortunately it's climbing up.
Mm-hmm. And so you see these new techniques as hopeful. And what else is important for a family with a child that has autism spectrum disorder? What other supports do they need? Do they benefit from? What do you see as some modifications in policy or in schools that should happen to support kids that you treat like that?
Definitely, since we know more about this condition and it's become common knowledge in society, so it's wonderful that it's, again, not so much stigma about this, and more school district recognize it and continue to help with individual education plans and inclusiveness and providing counselor support for these kids. Also, now we have much more sophisticated biological tools. We do chromosomal analysis for a lot of kids, and we try to figure out what kind of mutations happening. And for some mutations, we actually know how to intervene on biological level. So we have more and more medication which actually can reverse this pathological biological mechanism on early ages and prevent kids from getting to the severe autistic states. So we will continue definitely to explore these roads, because if we actually cure synaptic or enzyme level pathology or biological genetic expression, it would be definite cure for this illness. But we don't know a lot about this yet. It's only 1 or 2% of all biological process we aware. But we start to accumulate more and more science, and hopefully we'll get more biological tool to intervene at early age. And wonderful is that society start to pay much more attention, because we know that brain develops so fast first 3 years, and most synapses actually established at early age. And if we can intervene on this level where synaptic genesis is happening and when all the neural connection is establishing, so it's definitely will prevent pathology to increase in later age. So intervention like behavioral intervention like ABA and flow therapy and Denver model on early stages, as well as proper educational setting, as well as sensory techniques which parents start to use more. And hopefully this new neuromodulation techniques, which can probably would be much more available soon, would definitely work for this population and to prevent a lot of pathology building up.
And so more attention from society, more funding for research, more support for parents, things like that. And maybe just one more on autism spectrum disorder. I was talking to a neuroscientist recently, and she expressed that there's a new perspective where these folks are considered neurodiverse. I believe it's neurodiverse, not neurodivergent. Where do you fall on that? Or where do how many people fall into what's considered maybe neurodiverse versus pathological? Does that question come to you sometimes? And how should we treat those people? How do we, if so?
Definitely, because as we discussed, autism is not a single condition. It's a spectrum of different issues, including all kind of different modalities. So we have kids who are extremely sensitive and who can present with a lot of repetitive behavior or have social or language pathology. But again, all this issue, it's on a spectrum. Some kids have really severe disturbances, some kids close to norm. And we deal with diversity, neurodiverse population, which could be on any part of the spectrum. And what we need to do is just to recognize it proper and to have targeting and individual intervention, because each kid requires some set of treatments, and it could be implemented in different settings, in school, home, or after school program. And we don't talk about, in this sense, like pathology anymore, but we talk about number of issues which we need to address. And in this case, it's like everybody else has some issue which could be seen as a pathological or could be seen as a neurodiverse. So more we know, it will help us to include all kind of kids in this educational and social processes.
Yeah, it kind of makes me think when we talked about what is a healthy child or what does it mean to develop, and be okay. Part of it is social belonging, right? And part of it is having a path to a career and a family, etc. So if we're putting these kids into a separate room, a separate bucket, it probably almost precludes that in some ways. So it sounds like partially if you can include kids who are neurodiverse or in society, it might almost help their development. So yeah.
And I want to illustrate your point with a clinical example we have in these clinical trials when we took two siblings, twins, biological twins, which one ended up in active arm of the research protocol where we have actually photobiomodulation, active treatment, and another child was in placebo group, and both was nonverbal when they started treatment. They've been 6 years old back then, and on our eyes, the kid who been in treatment was really started to improve, and he started to use words, and he started to communicate with his sister and with his parents, and start to be more included in education and family life. And kid who was in placebo, he actually not just stuck, he actually regressed.
Wow.
Because he was excluded, he feel different attitude towards him. We saw a lot of physical symptoms show up, and he started to defecate in room, and he started to yell and have a lot of aggression. So it was such a big contrast that kids who don't receive treatment and who can leave behind, they actually not stay in same level. They can be regressed and they can be deteriorated. And it was so vivid and so obvious that we told parents that we need to finish study, and we will definitely include him in active group if he's in placebo. And when we finish this study, we did a follow-up study when we definitely include him in active treatment group, and we saw that as soon as he started to improve, immediately his social skills get better. He started to be more happy. All this pathological and regressive behavior disappear, and he become normal member of this family and the educational process. So you see how much in course of 8 weeks and 16 treatment, you can have so much dramatic impact on the social development and family dynamic. So it's huge. So in this age, we really can do a lot of harm, but we can do a lot of positive and amazing things.
It's an incredible story, and it must have been tough to see him regress in a way, but also so striking. And you could still, of course, intervene 8 weeks later, or whenever the study finished, if it wasn't too long. But wow, that's a really cool one. I think parents out there should know this. So I'm glad we're recording it. And you're touching, and your paper also referenced some potential co-occurrences where you're giving so much care to this family. There's twice weekly sessions, there's check-ins, there's research, there's attention. I mean, real conscious attention from both the parents and the kids. That could be partially why they improved, not discounting the biological component. And it makes me think about elderly folks who have caregiving, who have family interactions. To me, seem much happier than those who are more isolated. And it gets back to adolescents who are kind of isolated on social media, have a lot of pressure, maybe aren't the popular kid, or even the popular kids are sometimes the ones who have the worst psychology, really. That wasn't me, but, I'm aware of it. And so we're really bringing it full circle here to what makes a healthy childhood, adolescence, adulthood, and what feels good. So we definitely took the green pill today, I think. Dr. Yuli Fradkin, is there anything else as we finish up here you'd like to share, and any message you'd like to get out there to the world, to folks?
I think you touch a really great topic about not just illness, pathology, but also how to be healthy and how to be happy. It's different set of skills. When we talk about treatment, we always talk about addressing some pathological issue, but learning how to be happy and how to be healthy is also need education. So we need to learn how to be in a moment and how to work with our anxieties, which could be, as we talked before, it could be healthier, but we still need to know how to live with this and how to run about this and how to incorporate it in our life and use it for our advantage. I always teach my patients that being depressed is really bad, but at the same time it's actually have some positive feature, like it's make you more sensitive, more empathic sometimes, more able to reflect and to be observable, and it's eventually can give you some benefits, like normal dose of obsessive compulsive traits. It's actually could be really beneficial for you as a scientist or doctor or CPA, and if you know how to live with this and how to use it and incorporate in your life, it's actually can bring more fulfillment and satisfaction in life. So we really need not to focus on pathology, but live with what we have and really explore who we are and use it for our benefits. And what you do is really amazing to help with this process.
Awesome. Thank you so much. What a nice message to finish it. Thank you for coming on Green Pill. This was awesome to have you, and I know we've had a professional and personal relationship for a while, so it's a pleasure to finally be able to interview you. Thanks again.
Thank you, Alex.
All right, folks. Thank you for catching my conversation with Dr. Yuli Fradkin. I hope it was insightful on what makes someone develop in a healthy, nurtured way, and where are some pitfalls on the way. I hope you have some takeaways and can send this to any parent out there who can benefit from this information. And if you know someone whose child has autism spectrum disorder, there's a lot of what seem like novel and cutting-edge developments that Dr. Fradkin discusses here as well. As always, your support is appreciated. The best thing you can do is rate, review, and subscribe to my podcast, or send it to someone who needs it. Until next time, I'll see you soon.